CNMI, where Tomas Manglona is present at the Governor Ralph Torres' weekly press conference right here on the link. It is Friday, February 18th, 8:12. And to the CNMI we go. Good morning.
I think the due date is on the 22nd. I hope that this weekend our community stick together and write a letter against this sanctuary and ask to remove it from the request to put it into the sanctuary monument. So again, that's the information I get as of right now. So again, thank you very much. And I hope our community can stick together in fighting against this sanctuary proposal for a monument. Thank you.
All right, Gov. Thanks, Tom.
Hi, Governor. Just wanted to ask questions regarding three different topics. First is at the legislative hearing last week for health and welfare, CEO Esther Monia, who I see is on the call, stressed the need for a possible new hospital. And we learned of FEMA Region 9 office visiting at the end of the month to do an assessment of the U.S. Army Corps of Engineers. Where do you stand on the possibilities of opening a new hospital, building a new hospital, and also using ARPA funds to build that new hospital in the CNMI? What's your commitment there?
Oh, Thomas, thank you for that question. Actually, this topic is nothing new. This topic, CEO and I have been talking about it for years. Even in the first time that I got into administration, we talked about new beds, just putting in as much priority as we can to assist our hospital. Now there's an opportunity. We've worked on pushing forward and getting our MRI, getting our cardiology in, and looking at other specific medical care that we need here to address our current health issues here in the CNMI. We've talked about expanding the ICU beds. Currently, we have 4 rooms. We're hoping to definitely increase that. We looked at to have a separate building for the MRI and other scanning device that needs to be upgraded at the hospital. So our CEO is here. We can also have that chat. But yeah, the commitment has always been there to assist in any way that we can. When pandemic came in, we looked at what the hospital needs. Immediately, we built a parking lot north of the hospital. To some, that's not a big deal, but it is to everybody that's going to the hospital. And now we're moving forward on the building of new hospital and other facilities.
Governor, are you able to give a figure of how much of ARPA you're willing to commit to that project or the improvements or of a new hospital?
Well, it depends on what proposal is being made. There's some figures that CEO and I have been looking into, but as we move forward, there'll be more specific to that figure.
All right, I wanted to move on to talk about the news of the Attorney General suing the DPS chief over alleged illegal overtime pay. Yesterday, we got a chance to interview Attorney General Edward Manabusan, who says that they are considering moving forward with collecting more overtime pay from several other cabinet officials with regard to the U2 recovery. Can you confirm how many other cabinet officials received Typhoon U2 overtime pay, and your take on the Attorney General saying that he's basically going to pursue all the other members who might have received this excessive compensation?
Okay, so first, I don't know exactly who else got served or got overtime right now. I mean, I can get that information for you later on. But off the bat, I don't know the exact names or how much they got. Second, this whole issue here was recommended by previous OMB. That was recommended, and I asked that, can this be done? And the answer was yes. and so we move forward on it. Everybody got their working hours. They got paid overtime, and now with the AG pursuing that action was not legal, then it's not my position to say whether it is or not. But at the time that we did, I was advised that it was legal, and that's the reason why we move forward on giving everybody those that worked overtime. So the issue here was not whether they worked overtime, because they did work overtime during those disaster. The question is, should they be eligible to receive overtime? Now it's in the court, or they're pursuing it, and I'll have to respect that process.
All right, I wanted to move on to the last topic I wanted to ask about. KOM News submitted an Open Government Act request with regards to KKMP, the Secretary of Finance, and the Governor's Office. Gary, maybe also you might want to chime in here. Just wanted to clarify, we received over 800 documents that we're able to review. We want to get your comment if we're aware of thousands of dollars for COVID-19 public information and awareness campaigns, but we're also aware that here on this very press conference call, that at least in previous cases, KKMP has received about $500 per press conference and $300 for reruns of the press conference. Can you just speak to whether or not that is true, why that is the case, and also whether or not this was opened up to other similar media companies? It was my understanding when these press conferences began that this was a public information type of press conference. So can you speak to the payment of that, and also the fact that your media team is comprised of 6 people, and this press conference is being hosted over a Zoom link?
Okay, so what's wrong with having this press conference in making sure that our community knows more about the situation that's going on with the government? I remember during U2 that this was one of, if not the only radio station at the time that was up and running, and also was able to do a public information moving forward, as well as the pandemic. When this pandemic came in, KKMP was always there. And so for us, we want to make sure that this information is disseminated the right way. So I have actually reached out to some radio station and have said that they're not able to accommodate this, what we're doing on a weekly basis. So yes, Tom, I have reached out to other radio stations. And for me, it's definitely a good way for me and the government to push out informations. With our media team here, they've done a phenomenal job in going out to the community and showcasing what we do here in the community and other activities within not just the government, but other activities, whether it's in Rota, Tinian. I can't expect KKMP to follow me or go to Rota and Tinian to do social media or public information. They're radio broadcasts. And this is an avenue for me and the government to, again, call you, call Maury, and call other entities at one time and get interviewed.
And Gary or anyone at KKMP, if you want to comment, I think the concern here, in our reporting is, what exactly is being paid for, given that it is a Zoom link and that this is open to the press, and the press wasn't informed that this was a paid forum for this information to be done this way weekly.
Okay.
Are you addressing me, Tom, or the governor?
Sure, I would like your response, given that the documents are related to KKMP. Yeah,
well, we're a business. We have a business license. We pay our taxes. Just like everybody else, we have a rate sheet. You're free to look at it to show that we're not overcharging the government. In fact, we're charging less than what we would have charged to people who don't have a long-standing commitment to our services. And we're a business. We do sales. We promote. We put out things. And I didn't know I had to report to the press that this is a paid news conference. In fact, this was just supposed to be just me, just KKMP. But I decided it's good to open it up to everybody else so that everybody can have the same information. And you're free to ask questions. We've never said no questions or anything like that. So it's an open forum. I think this is as open and as transparent as you can get by having all of the media partners. But if you feel you shouldn't be here because you're not getting paid, that's fine.
No, I don't think that's the issue. I'm happy to show up anywhere. It's my job to show up to question public officials. Governor, just one more follow-up question with regards to this. You do have a team of 6 media personnel. Is this necessary? Do they know how to do Zoom and broadcast live on Facebook as well? Does the government have that capabilities? Sorry, Governor, you're on mute.
So yeah, I'm in Zoom right now. We are a pandemic again, and we don't go in. And then the access of utilizing this information with KKMP, with my media team, we have different avenue on how to showcase what we do as the administration. If you haven't seen some of the videos that they've done, maybe take some time and look into the things they've done on the media. Is it important that to have 6 people in the media? Absolutely. This is our own, not our own local talent. They come in different backgrounds, and it's a time for them to showcase what they know and how to do social media. Not just social media, but actual work that we do here in the government. And that comes in also with press releases and other media issues.
And so can you confirm, is it $500 per press conference and $300 for reruns? Is that still ongoing currently right now as well?
Yes, that's what we're charging right now for this Zoom over here. And Tom, the government does not have a radio station. We're broadcasting this island wide, across the islands, through cars, anywhere, your computer. We're broadcasting this besides the Zoom broadcast and the Facebook broadcast.
All right. Thank you for the responses. Appreciate your time.
All right. Thanks, Tom. Appreciate it. Maureen, you have the floor.
Thank you. Good morning, Governor. Good morning, everybody. So I'd like to ask a couple of questions about the hospital. I'm familiar with it from visiting people there. I'm familiar with it because we've written about the building's deficiencies and also remediation that has been done already and has been discussed. So my question is, where would you put a new hospital, firstly?
Esther, our CEO, is here. She can chime in, but we've looked at different areas, and it always comes back that we have a main hospital, or we have one hospital, right? But since that's our one hospital, it's easier and better to expand where there's upwards, if we're able to, but adjacent to the lot that we have north of the hospital, and try to maximize going up. But closer to the main, again, we only have one hospital, closer to the main building would be best and ideal, unless CEO disagrees on that.
Okay.
No, I don't.
Okay. It is very easy to reach, that's for sure. So my second question, if you look at what has happened with Guam, so for planning purposes, there's a grant available from the U.S. Department of the Interior to fund a study. Yes, the Army Corps of Engineers visited Guam too. And so they estimated that any study that they put out could take as long as 3 years. So I know that the issues with the hospital in Saipan have been ongoing, but the question is really, would you want to wait 3 years if that's what they said it would take for Saipan, or would you look at other options for planning?
Well, for one is we don't want to wait 3 years, but obviously if that's what it takes to get it comprehensive, then we should take that advantage and utilize that proposal. But in the meantime, I think that we have a priority. We have priorities with CEO, and maybe we can address one or two of those priorities and build a portion, if not extend at least the ICU rooms. Obviously, we'd like to build our MRI, CT scan, hyperbaric chamber. I mean, those are the things that we want to increase and have the capacity for our CNMI and then other special treatments that our CEO and our doctors recommend. But I think we should act on those specific concerns and address those as we wait for the overall or comprehensive study as recommended. CEO, would you want to chime in?
Yeah. So, the governor and I, and also with Warren, because he is our facilities director as well, have been meeting and, discussing about this. The land across the street does belong to CHCC. So there is, a plan. It's an initial plan. We did request for an A&E, and that was unfortunately denied by Department of Interior. So obviously there's an opportunity to go back to the table, and with the pandemic and the President of the United States issuing, a directive of, expanding the hospital. We do have a team that's coming in next week to work with our team here. We are inviting our doctors, our nurses to have a brainstorm idea of what can be done now and, address them now. And as the governor stated, there is, we've been talking about having an MRI, and expanding the hospital, expanding the ICU. For anyone that has come to CHCC, parking has always been an issue. So that's something that also we're looking into, a multi-level parking. We are also looking at offices, the oncology department. We built it, and then more people came, and then now we need to expand. So there's a lot of opportunities to expand. People need it. Since October, I've been in charge of medical referral, and I'm looking into that as well as how we can, build, integrate our system with other providers. And I did have a meeting with Lillian Posadas as well to strengthen our relationship and ensuring that, whenever we spend money for off-island referral, we need to make sure that we analyze, what can be done here so that people don't have to leave, because there's a lot of individuals who want to be here and don't want to leave for care. And so we want to be able to bring that and make sure that people have better access to health services, and working with the governor and of course, trying to make sure that this is completed. But yeah, thank you.
So last question to you both on this topic of the hospital. So FEMA is coming in, but you have doctors on Guam, you have, you have doctors in the CNMI, you have engineering firms that will they be part of the discussion process so that they can weigh in from a perspective of helping both the administration and FEMA in if there's any sort of round table or meetings?
Yes. Can I go ahead and answer that?
Yes.
The meeting that we're having at the the meeting that we're having at the end of this week will include PA Guerrero, also our task force chair, and the doctors and nurses, and again, of course, the administration, the CFO, the facilities, team that we have here at CHCC. So it is going to be a brainstorming discussion first with HHS. So, again, this is it is a public health emergency, and HHS needs to support whatever plans that we are going to pursue. And so they are going to be there. And in fact, when I sent the invitation the other day, they will accept it. So they will be at the table, and then the team, whoever, whether it's ASPR, USACE, will basically meet with each team to decide, and then they will make a proposal.
Okay, thank you very much.
Welcome.
All right.
All right, Gary, I think we're done.
We got Freddie there.
Oh, Freddie. Freddie,
Jason.
happy Friday, Freddie.
Good morning, Governor.
How are you?
Good. What's your comment about Representative Selena Babauta's statement that blaming GGO for your legal fees is disrespectful to Constitution?
How can it be disrespectful? Every individual has the right for an attorney to be represented. The AG wrote a letter or denied to be represented by the government, and therefore every person who's been subpoenaed has the right for legal counsel. How do you deny that? So if a person wants to exercise their right, who pays for that? Obviously, it's the government. So who do you blame for that? She's the one that did all the subpoena. And so when an individual wants, what's more sad here actually, is when your right to speak tomorrow and refile wash is denied. That is the most embarrassing part. Not legal fees. You charge, subpoena somebody, they want to exercise their right, and that is part of their right. So if there's no subpoena, they wouldn't be charged on their legal fee.
Second question, Governor, what's your take about the House Ethics Committee's meeting yesterday, in which members agreed that the 2 complaints against Ed Props should proceed?
Well, again, right, this is a process that there's ethics committee. If I'm not mistaken, there's complaints about misconduct and misuse of authority. And so I'm not sure exactly what are the details. But what's troubling though yesterday was I thought it was going to be live streamed. All of my hearing on the JGO was live streamed. Why was the committee not live streamed yesterday? Why wasn't the community had the right to see what's going on? So that's the troubling part. Other than, of course, and I'm happy that they're moving forward on it. Obviously, it's important with these kind of actions that they take serious consideration on every action. But I think the community needs to know what's going on. And I hope that the next meeting, it'll be live, just the way the JGO did live on every hearing that they did on my investigation process. So I look forward to that, and I hope that they always talk about transparency, nothing to hide, open to the community. So this is exactly what we're going through.
And Governor, who do you believe is a stronger gubernatorial opponent in this November 8th election? Is it Tina Sablan or Arnold Palacios?
That's my least of concern, who's stronger or who's weaker. My concern is to move forward on what my mandate is. People voted for me to do what I need to do, continue to focus on giving the retirees their 100%. And I hope the legislature actually act on it and give them their bonus of now it's $1,000. And I will continue to do what I need to do again, not just protecting the retirees, giving them the 100% and hopefully giving them more bonus as time progresses, making sure that we bring back the economy, bring back our Japanese tourists, our Korean tourists are obviously still coming in, and reach out to other tourist destinations, give opportunity to our youth.
All right, there's Governor Ralph Torres.